Upstream factors relate to population health because they are part of the underlying social conditions that drive our collective well-being. In medical sociology, we study the health of societies and the healthcare systems in society to learn more about the culture and the social structure of that society. So we often look to fundamental causes. Fundamental cause theory states that there are underlying social conditions that play a role in shaping population health. So aspects of a society such as economic inequality, racism and segregation, and social support systems shape the health status of both individuals and the collective. So to understand what societal level factors are when it comes to health, we can look at the river of life and the waterfall of death. A common cause of death in our society is heart disease, which could lead to a heart attack. With medical advances, it's definitely possible to survive a heart attack. But if the cause of death was a heart attack, one of the underlying causes would be heart disease. We know, of course, that there are genetic factors in getting heart disease, but the field of epigenetics is showing us that there are many relationships between genetics and social conditions. In fact, some genes can be literally turned off and on based on our social experiences. And those experiences affect our behavior and affect future generations. So genetics play a role, but so do things like nutrition, how much exercise you get. We have the research to back up the assertion that diet and exercise can relate to your risk of heart disease. And this is true at the population level as well. But what are some of those factors that increase or decrease our likelihood to exercise or have a healthful diet? One of the big things that people mention is stress. Stress could be a part of your relationships, it could be a part of your psychology, and that could also be affected by your social environments, for example, the workplace. Education is also a factor. Not only knowing what it takes to have a healthful diet, but having a higher level of education is also related to being more optimistic about life, which affects your psychology, your motivation, and your ability to care for yourself. All of these arenas are affected by the economy and various policies that relate to the prevalence of even having meaningful work, even having the income it takes to purchase the food that you need to purchase, or even engage in exercise. These underlying community level factors drive the rates of illness in our society, and they affect our overall population health status, like our life expectancy, the prevalence of mental illness and addictions in society, as well as the prevalence of chronic illness and access to healthcare. These factors are social factors. They're studied by social scientists that are interested in understanding how population health can be improved by tracing it back to these underlying fundamental causes. So economic policies and the relationships that we have between groups in society, our own psychology as impacted by the messages that we get in the media and other arenas in society, they all shape our behavior, which ultimately trickles down to the mortality rates and the illnesses that our population faces. For true population health improvement, we need to understand what drives population health, investigate the social conditions that create an environment where many people can thrive, And we need to understand that as a society and a culture, there are things that we can do to create the conditions for better health.